So good morning, Austin in Thorold, Ontario. Welcome to our program.
Good morning. Thanks for having me.
Day one, back to school. How are you heading about this, or feeling, I guess, Austin, about this new reality as students and everybody comes back to class?
I think I'm feeling good. I've obviously been lucky to be immersed in the content for the past few months. So, of course, I have, some concerns. There is, of course, some risk associated with returning to school. But really, when cases are low within the community, there's a low risk of transmission within schools. So I'm fairly confident.
Okay, we'll talk about the risks in just a second, but help us understand what exactly will your role be as a public health nurse with the schools?
Of course. So typically before this, I was assigned to 14 schools, and my job was really to focus on comprehensive school health and meet their needs and tailor programs to their needs. Now moving forward, we've actually changed our model a little bit. So I will actually be assigned to priority schools, so schools that are more high needs. So in my role, I'll be focused more on infection prevention and control and providing them with the supports and education and again, that comprehensive school health approach to make them feel that they're supported and that they can actually prevent COVID from entering the schools.
And how many priority schools will you be working with?
Currently, I have 3, but of course that's going to continuously be evaluated, so it may change.
How much interaction with students and teachers and movement among those 3 schools do you anticipate, Austin?
I anticipate not too much. A lot of what we've done here at Niagara Region, we've actually adapted our model to be more of an online delivery. So we have a COVID info line and a school health focused info line and a live chat. So a lot of the resources and supports that I'm going to be giving are going to be more of an online delivery with a few scheduled visits and check-ins with the schools.
Okay. So in terms of your own personal health, moving around and all of those people in different schools, how do you feel about that? Do you feel it's a manageable risk?
I think it's very manageable. I think the largest part of COVID prevention and infection prevention and control is that prevention piece. So I think the main thing about that is really about active screening, physical distancing and good hand hygiene, and PPE use, so proper mask etiquette. So I'm fairly confident in myself because I've been, as I mentioned, immersed in this content. I'm very comfortable with it, comfortable with the risk of transmission. So it really comes down to those prevention pieces. So I'm fairly confident that I'll be able to move between my 3 priority schools pretty well.
Okay. The things that you just laid out, the preventative measures that we all know, it sounds like reinforcing those messages and re-educating, that's going to be a big part of the job that you're going to have. I'm wondering, though, as well, we've been talking on this program, many people have, about the anxiety level, the stress level of students and teachers. How much do you think mental health is going to be a component of the work you'll be doing?
That's actually one of my biggest concerns. I think, as I mentioned, that risk of COVID is low if there's low case counts in the communities. My biggest concern is that mental health piece and making sure that parents do feel comfortable. I think most of my job will be that reassurance piece and providing them that education and that support necessary for them to feel comfortable with this transition. It's a lot of new information. It's a lot to ask of students and teachers and parents to return after 6 months of being off with little education. So the best thing that we can do is provide that education and support, and it's going to be a collaborative effort moving forward. So I can only imagine it's going to be a large part of my job.
How prepared are you for cases in the 3 schools in which you're working?
I would say very prepared. I would say, so I personally have been working in case management and contact tracing since March. A lot of our school health staff and public health staff in here in Niagara Region have. So I'm fairly comfortable with case management and contact tracing. It's a very easy process. That being said, it's easier to prevent than to manage cases and an outbreak.
So you feel confident about that, but what will happen in your specific cases if a student or a teacher or a staffer does test positive? What are you going to do?
Of course, there is a risk associated with that, and there will be cases within schools, of course. And in that circumstance, it's really a case-by-case basis. Every case that we manage here in Niagara and in Ontario is a case-by-case basis. We look at things like exposure, length of exposure, PPE use, physical distancing. There's a lot of factors that we go in to consider who needs to self-isolate, how long they're going to self-isolate for, and yeah.
So
there's a lot of factors
that they have to consider before, case becomes, outbreak becomes, to the position of, maybe having to shut that school down. But it's all laid out. Is that what you're suggesting?
Well, by definition, an outbreak is two confirmed cases with a link, like an epidemiological link. So really, in that case, it's really the cohort that's going to be asked to self-isolate. I don't see many whole schools shutting down unless there's evidence of secondary transmission, unless there's evidence and we can find reason to believe that there is other transmission within the school. Most likely, you're going to see one cohort be asked to self-isolate, or let's say a few students or anyone who were in close contact with that individual.
Okay. In every province, we've heard questions and criticisms from parents, teachers' unions, but you're in Ontario, so let's focus on that. The criticism of the Ontario government for changing plans, for not communicating. I mean, the list of complaints is long. I'm wondering what your experience has been in terms of preparation and training, and how well you've been equipped for what you're about to take on as of today.
Of course. And a lot of these decisions came very last minute. And of course, that causes a huge amount of frustration. Really, to feel comfortable to return to school, it is about, like you said, that education, that training. And luckily, I've been in this content. I've been educating people daily about this content. So, of course, I've had the preparation. But I understand the anxieties of parents, and I understand the anxieties of teachers when they're asked to return with very short notice and very a short time frame to turn around. The most important thing is that this is going to be a collaborative effort moving forward. This is going to be a constant partnership about educating, and I want parents and teachers and educators and staff to know that they're not in this alone. We're not asking them to do this alone, that this is a partnership moving forward. This is something that you can reach out to your public health unit. For example, we in Niagara region, we have our COVID info line. We have our staff specific COVID info line for educators. This is a collaborative effort moving forward, and I understand the anxieties, but it's going to be a constant process, and it's really a learning opportunity and a collaborative effort.
Austin, thank you very much, and best of luck as you embark on all of this. We'll check back to see how things are going in your schools, but I really appreciate the time this morning on such a big day.
Thank you so much.